Assalamu alaikum. The topic that we are going to talk about or have a little discussion today is epilepsy. Now, epilepsy is one of the most overlooked disorders in neurology. Epilepsy can come to you in the clinic with various different types of symptoms. Why does epilepsy occur? Epilepsy occurs as a result of abnormal electrical discharges in the brain that causes activation of certain areas of the brain which should not be activated in the usual state. It can result in motor symptoms, which is usually represented by abnormal movements of the body. It can present with behavioral symptoms. It can present with deja vu, etc. Now, it is very important to identify the treatable causes of epilepsy, which can be any metabolic disorders such as hyponatremia, hypoglycemia, hyperglycemia, thyroid-related disorders, or autoimmune disorders. But usually in children who are less than that of 12 years of age, usually we think that they might be a genetic cause which is associated with that of epilepsy. Therefore, ruling out hereditary or taking a thorough family history is very important in such cases. Whereas in adult onset epilepsies, we always look for a cause. Now, if any cause is not identified, you label the person as having idiopathic epilepsy. Now, in Pakistan, this is basically a stigma. The patients are usually taken to certain quacks or certain other people who think that there is a supernatural phenomena which is involved in this, but it is very difficult to make the attendants understand that this is basically a disease. Proper identification and treatment of the epilepsy is very important, because all the types of epilepsies have specific first line treatments which is necessary to be taken, and to be taken with a proper regime according to the anti-epileptic disease therapy. And it is also important that these treatments should be taken on time, according to the weight, according to the type of epilepsy, and it is also very important to monitor for the side effects of these drugs.